Most people think healthcare is complicated because medicine is complicated, but a lot of the frustration that people experience in healthcare isn't medicine. From my vantage points, many of healthcare's coordination challenges may actually be rooted in the underlying information architecture of the system. In other words, how the information is moved through the system. Right now, when a patient receives care, multiple organizations reconstruct the same core information independently. And urgent care is a prime example of this. It's a good example. When a patient walks into a clinic, the clinic verifies identity and eligibility. When the visit is closed, the billing system reviews that claim, and then the clearinghouse checks the claim structure and re-verifies eligibility. And then the payer re-verifies eligibility and the provider's credentials before payment is even initiated. So as you can see, the same information gets rebuilt over and over again across the network, and this obviously causes delays and friction and a lot of administrative overhead and burdens. So the idea that I have been exploring is what would happen if we recorded and anchored in the state of the system at the moment that care occurs and allow other participants to reference that verification instead of having to rebuild it. Simple, I know, but no one has done it yet. Let me preface this by saying this would not replace EMR systems or billing systems, okay? It would simply sit underneath those systems as a shared infrastructure, recording verifiable system states when they occur. You can think of this whole system as having three separate layers. The first layer would be at the bottom. It would be the verification layer that we were talking about. It would anchor in those trust signals and those core signals such as identity, credentialing, and the care event itself, specific core information from the care event that's necessary for insurance payments. We'll get to that in a minute. Above that verification layer would be the continuity layer, right? It would track how care is evolved and how it evolves over time. It would track the diagnoses, the treatments, the outcomes, the follow-ups, things like that. And then on top of that, that's where the applications would sit, the EMR system, the billing systems, the analytical platforms, and the patient tools that all interact with the system. And so the verification, the bottom layer, would simply record and anchor in those trust signals that the rest of the system could reference. And I'll post it right here on the side, but it would look something along the lines of this, just to give you a visual, something along the lines of like a receipt, right? It would have like the care event ID at the top, the patient ID, and it would stamp it and say verified. Yes, you don't have to recheck this again. It's been verified. Eligibility active, provider credentials valid. Specialty is urgent care, stamped and done. And then the facility credentials verified. You don't have to check all of this again. You don't have to do repeat information, just verified, stamped on the receipt. And then it would go into a clinical encounter. It did occur. That's all you need to know. It occurred. Everything was done properly. It occurred. Intervention was initiated. Disposition complete. Follow-up was scheduled. You can also add in something along the lines of drug administered and then the name of the drug if you really want to get into like the subcontext of what you want on the receipt. And then based on those states and those criteria being valid and verified, insurance payments settled. It shouldn't be any more complicated than that for the core information. And so each of these states would be time-stamped and attested by the appropriate authority. So instead of organizations reconstructing the same signals, they could reference this shared verification artifact. And over time, events like this could generate a neutral evidence layer for the system, aggregated signals that of what actually happens in the real world of care. And the reason why this is important is because today many healthcare organizations rely on proprietary data sets that are controlled by many different actors. For example, pharmaceutical companies, they rely on clinical trial data, and manufacturer-sponsored registries for their information. Insurance companies rely on internal claims data and utilization analytics. Hospitals and health systems hold all of their outcome data in their EMR system. PBMs, the pharmacy benefit managers, they control prescription utilization and formulary performance data in their systems. So each participant is negotiating with their own data and their own interpretation of that data. But if verified care events were anchored in and accumulated across the networks, hospitals, urgent cares, primary care, specialists, outpatient services, and pharmacies, the system could itself could begin generating shared verifiable evidence around those utilization patterns and those outcome monitoring and as well as safety signals. That kind of verified evidence layer could also support stronger contract enforceability. It could also open the door to a greater patient agency where patients can actually choose to share their verified care artifacts for research and outcome studies. There's so many possibilities that could happen if we had a verification layer and then the continuity layer on top of it that all coordinated with the applications themselves. So the idea isn't really to change medicine. It's really about exploring whether some of the coordination problems in healthcare can be improved by redesigning the information architecture that sits underneath care delivery. And if you need a parallel to something to reference to, it's similar to how financial networks move shared authorization settlements across their system. Healthcare may eventually be moving towards something like that, so we might as well start now where the system itself can reliably record what happens, and that's exactly what this is. When that happens, coordination becomes easier, evidence becomes clearer, and trust doesn't have to be reconstructed over and over again. And that opens the door to a health system that is not only more efficient, but also more transparent and collaborative.